Hello, my name is StephenMarquette, and my topic of research is cannabis in sports, why sports leagues should transform into a medicinal marijuana culture to benefit the health needs of athletes. For decades, officials in Congress have debated whether or not medicinal marijuana should be classified as an illegal drug. People who are against the legalization of medicinal marijuana argue that it can be a gateway drug into worse drugs, while cannabis users believe it truly heals physical and emotional pain. Marijuana is often stigmatized badly on the internet and can cause people to form a biased opinion based on what they see. Edward Kessler, founder of the Wolf Institute, says that the anonymous trend in social media makes it easier for information to be distorted or misinterpreted. I am arguing that there are many positives with the use of cannabis that these sports executives may not know about, that there should be consideration in transforming the sports world to a culture that permits the use of medicinal marijuana for their athletes. Most athletes often use cannabis already, whether it be to reduce pain or to increase mental preparedness. Martellus Bennett, former NFL tight end, estimated on a Sims and Lefkoe Bleach Report podcast that about 89% of the league smoked marijuana before he retired in March of 2018. However, because recreational cannabis is still illegal in most states, most sports leagues prohibit their players from using it and will have consequences if their players test positive. I decided to base my research around this research question that sports executives can ask themselves: can the legalization of medicinal marijuana in professional sports be beneficial to the athletes? And my research has led me to my thesis statement that is, allowing the use of marijuana as medicine for sports leagues differs when it comes to the high-contact leagues, but it would be beneficial to the players by healing pain and substituting painkillers. The culture of contact sports leagues differs when it comes to how they view the use of marijuana for their players. The NHL has no problem with their players smoking marijuana and is comfortable with their current policy. However, the NBA and NFL prohibit their players to use it, and the NFL will suspend or fine players if they test positive. These two leagues should move towards a culture similar to the NHL. In an article written by Dave Royce, he describes an NFL and NBA stand on marijuana use in the leagues for their players as of 2019. Royce writes that the NFL is not a fan of legalizing the drug as of use for now, but according to NBC's PFT blog by Jim Florio, the NFL is hoping to offer to make changes to their current policy, which prohibits players from using cannabis as parts of its negotiations. As for the NBA, Royce mentions that the commissioner of the league, Adam Silver, is assessing the current situation currently, but says his players are not treated harshly if they test positive. However, sports medicine specialist David Geyer explains in this article for Sports Medicine Simplified that Adam Silver is said in an interview that the league was more concerned about performance-enhancing substances. He preferred his athletes still do not use marijuana, but agreed the league could adjust its stance over time. Through this evidence, it is promising that the future of the sports world transforming into a culture that permits the use of marijuana is highly possible. If the NFL and NBA did offer a change to their policies, it would mitigate the use of painkillers that these athletes would consume throughout the season, which would be beneficial to their health. Even though these leagues have different viewpoints as of now, there is a good chance that they could all agree on what they stand for cannabis use for their players in the near future. The use of cannabis for athletes would be beneficial to their health. Because marijuana contains CBD, athletes should be able to use it for healing and to help with mental preparedness. According to an article in Healthline by Julian Caballo, who has a master's in nutrition from Stony Brook University of Medicine, studies have shown that CBD may help reduce chronic pain by impacting endocannabinoid receptor activity, reducing inflammation, and interacting with their neurotransmitters. In other words, marijuana has many chemicals inside of it that react with the neurotransmitters inside of the brain. And in this case, these chemicals bind to the cannabinoid receptors inside the nervous system and help reduce minor or even chronic pain. In March of 1999, the White House launched one of the most comprehensive analyses of marijuana to this day. In a journal article written by researchers in business and law Peter Clark and Peter Cohen, they described that 11 independent scientists appointed by the Institute of Medicine determined that there is therapeutic value in controlling some forms of pain, alleviating nausea and vomiting, and combating muscle spasms. For athletes, they face physical pain and muscle spasms throughout the course of their entire season. Also, players in the NFL and NHL are constantly being hit, which can cause concussions. And most of the time, nausea and vomiting is one of the symptoms of these head injuries, and marijuana can be used to control that nausea. Lastly, cannabis can be used in the off-season for controlling training. Using marijuana in the off-season can help these athletes improve their craft by helping them with mental preparedness, but while limiting the amount of stress in their muscles. Integrative cannabis physician Dr. June Chen suggests athletes use cannabis during the training season to help recover, ease pain, and push to the next level. They can run longer, be faster, and be more efficient. Marijuana helps athletes build mental endurance, which allows them to power through workouts or even games. To conclude, sports professionals can benefit highly from the use of marijuana by healing pain and helping themselves get through tough workouts. Although medicinal marijuana has many positives, Contact sports athletes are forced to use some of the strongest prescription drugs in the world throughout the course of their season, such as morphine and oxycodone. These painkillers are classified as opioids, which can be deadly if the drugs are misused or abused. Athletes should advocate the use of cannabis in sports to substitute these painkillers. Evan Britton, who retired from the NFL in 2014, said while he was playing that he realized very quickly the prescription drugs would make him feel insane. He said, quote, I had cold sweats in the middle of the night with withdrawal symptoms and a knifing sensation in my gut, end quote. Athletes are given these prescription opioids to relieve all of their aches, which would seem to be a lot of pills often. For some people, because of the effect of opioids in the brain, addiction may occur in less than 3 days. Assuming Britton is not the only athlete who uses painkillers often, there are probably many cases of opioid addiction out there when it comes to athletes. Martellus Bennett, who was previously mentioned, also advocates the use of medicinal marijuana in the leagues rather than painkillers. Master Tesfacion later mentions him in his article, saying that, in Bennett's words from the interview, said that there's times of the year where your body just hurts so bad that you don't want to just be popping pills all the time. There's a lot of these anti-inflammatories that you take for so long it starts to eat at your livers or kidneys. Research at the University of Michigan shows that prescription drug painkillers can lead to severe liver injury no matter the dose or how long an athlete has taken it. Liver specialist in the University of Michigan Hepatology program, Robert Fontana, MD, says that most people with drug-induced liver injury recover fully, but 1/4 of patients will die, need a liver transplant or have lingering problems 6 months after onset. As shown, there are many detrimental health effects on athletes that they must face throughout their careers and later in life due to taking painkillers. Sports leagues should transform into a medicinal marijuana culture to substitute these very dangerous pills. Although medicinal marijuana has many positives, there are always negatives when it comes to the use of cannabis. Athletes using medicinal marijuana could lead to them having long-term health effects after their careers and can influence the younger generation poorly. According to an SSRN article by adjunct associate lecturer at the University of Sydney, Tony Bogdanowski, the possible long-term health effects risks associated with marijuana include carcinogenicity, respiratory, and cardiovascular problems. Similar to all other forms of smoking, there's a risk of damaging the lungs and heart. Carcinogens can enter the lungs through the smoke and can lead to a possibility of cancer later in life if the way in which the marijuana was used related directly to tobacco. However, there's yet to be a diagnosis of cancer caused by marijuana use, and doctors will often recommend a chemotherapy patient using medicinal marijuana to reduce pain. Dr. David Geyer, who was mentioned earlier, says that NBA coach Earl Watson fired back at Steve Kerr's remarks when Steve Kerr mentioned in an interview that he tried marijuana to control his back spasms. Earl Watson said that Steve Kerr should not have made those remarks because he was worried it could send the wrong message to kids. And Geyer writes that Watson believes that marijuana could be the first step to the use of more dangerous drugs, dropping out of sports and involving in crime. Watson, who is obviously against the use of marijuana, would agree that there are some negatives when it comes to the use of cannabis. In conclusion, sports leagues should transform into a culture that allows the use of medicinal marijuana for their athletes. Because some executives in the leagues would still be hesitant due to the long-term effects of smoking marijuana, such as lung cancer and heart disease, a solution to this problem can be solved with CBD or cannabis oils. These oils can be used as a lotion athletes can rub on areas where they have pain. According to an article by author John Johnson in Medical News Daily, he explains that all cannabinoids, including CBD, attach to receptors such as CB1 and CB2 receptors. When attached to the CB2 receptor, they reduce inflammation and pain. The implications of the solution would be that CBD oils would serve as a much healthier alternative to painkillers and could help with healing pain for athletes. The only limitation to this alternative is that if too much of the CBD oil is used, it could result in possible side effects such as hallucination and depression. All in all, sports leagues should consider the legalization of an illegal substance in their leagues to benefit the health needs of their athletes.
All right, thank you. All right, Stephen, first question. How did you select the strategies you used to gather information and conduct research?
Well, I used an essay outline that allowed me to pick out my claims that I wanted to use first, and that led me to my thesis, and I based all that research around a research question that I came up with. And then once I had my claims, I just had to find the evidence that I wanted to use that fit correctly, and I used sources that were credible to find that evidence.
Thanks. Then what additional questions emerged from your research? Why are these questions important?
I would say the biggest question that emerged from my research is whether or not that the players of the league, you heard me say that 89% of the league, in Martellus Bennett's opinion, smoked marijuana in 2018. But I would wonder if the players who are against the use of marijuana would be okay with the leagues making an adjustment to their policies. And because if they aren't, then obviously they would have to speak up about it, and that could cause a bigger problem. So that would probably be my biggest question that emerged from my research.
Okay, all right. Thanks.